Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Parkinson's disease. Introduction. Parkinson's disease, or PD, is a common disease that changes muscle movement and control. It affects millions of people worldwide. The symptoms of Parkinson's disease are easily treated. This program will help you understand Parkinson's disease and how it can be treated. Anatomy. The brain is the control center of the body. The brain controls movements, sensations, feelings, personality. The right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. The brain cells that make the brain are called neurons. In most cases, if a neuron dies, a new neuron will not grow in its place. Most other cells in the body are replaced with new cells if they die. Chemicals called neurotransmitters help neurons talk to each other. When neurotransmitters are balanced, the brain functions smoothly. Dopamine and acetylcholine are neurotransmitters in the brain. They control movement. A small area in the base of the brain makes dopamine. This area is called the substantia nigra, or the black substance. The causes of Parkinson's disease are not known, but we know that in people with Parkinson's, neurons in the substantia nigra slowly die off. This causes less dopamine to be made. With less dopamine than normal, there is less dopamine than acetylcholine in the brain. This imbalance causes the symptoms of Parkinson's disease. Symptoms. Parkinson's disease usually affects people around the age of 60. It affects people differently. Some people have almost no symptoms, and others have a lot of symptoms. The first symptom of Parkinson's disease is usually shaking or tremors. Tremors are often in the hands or arms, but they can also occur in the legs, feet, or jaw. People with Parkinson's usually shake when the body is not moving or at rest. The shaking normally goes away when the part of the body that shakes is being used. Tremors usually stop when the person is asleep. Parkinson's patients may have muscle stiffness in the neck, shoulders, or arms. It can make it hard to bend the legs or arms. Over time, muscle stiffness may cause muscle aches. In advanced stages of Parkinson's, muscle stiffness can result in a stooped posture. Parkinson's disease can cause balance problems, which affect the way a person walks. This could cause the person to fall down a lot. Bradykinesia, or slow movement, causes Parkinson's patients to shuffle their feet when they walk. It also takes extra effort to start moving. Unconscious movements, such as blinking or facial expressions, may also be slow. Slow facial expressions can lead to a condition called poker face. This makes it so the person shows no emotions in his or her face. Bradykinesia can eventually make it impossible to swallow. When this happens, the person might drool. At its worst, bradykinesia can cause freezing. This is when a person feels like he or she cannot move. Freezing can prevent a person from getting out of bed or eating by himself or herself. Additional symptoms that are less likely include depression, personality changes, dementia, difficulty sleeping, problems speaking, sexual complications.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Treatment. Parkinson's disease is usually treated with oral medications first. The goal of treatment for Parkinson's disease is to balance dopamine and acetylcholine in the brain. A very common Parkinson's medication is called levodopa or L-dopa. It is a chemical that the brain needs to make dopamine. Chemicals in the blood called enzymes destroy L-dopa quickly. L-dopa is mixed with carbidopa in a medication called Sinemet to treat Parkinson's. Carbidopa prevents enzymes from destroying the L-dopa. Medications that do the same thing as dopamine in the brain are also used to treat Parkinson's. A couple examples include ropinirole, Requip, and pramipexole, Mirapex. Parkinson's can also be treated with medications that counteract acetylcholine. This compensates for the lack of dopamine. These include Artane, trihexylphenadiol, and Cogentin, benztropine. Some medications prevent the breakdown of dopamine in the brain. These include selegiline, Eldapril and Zelapar, and entacapone, Comtan. Scientists are also continually developing new medications. Ask your healthcare provider about the best option for you. Unfortunately, some medications for Parkinson's disease have side effects that include nausea, depression, dry mouth, blurred vision. After a Parkinson's patient has been taking medicine for a while, he or she might start having jerky movements in the face or arms. This is called dyskinesia. Parkinson's medication can also make a person go from having good mobility to suddenly having almost no mobility. This is called on-off phenomena. This also happens when the disease reaches advanced stages. It is important to tell your healthcare provider about any symptom changes or side effects. A log or journal that shows what time medications are taken and any symptom changes can be helpful. The dose or combination of medications may need to be adjusted over time. It is very dangerous to stop or change medications without discussing it with your healthcare provider. This should never be done unless your healthcare provider advises it. Similarly, it is not advisable to take over-the-counter drugs, natural remedies, or homeopathic treatments on your own without telling your neurologist. Even though some of these may be helpful, their effectiveness has not been proven, and they could interact with other medications with potentially severe consequences. Oral medications usually work very well at first, but as the disease progresses, they may not provide consistent relief. Some patients also have trouble swallowing oral medications. These patients may try a patch, injections, the placement of a tube that carries medication to the intestine, therapy, surgery. Rotigotine, Nupro, is a patch that delivers medication through the skin. An injection of apomorphine, Apoquin, could provide short-term relief when symptoms are at their worst. Your healthcare provider may recommend placing a tube that carries a gel version of carbidopa and levodopa straight into the small intestine. Physical and occupational therapy can improve posture, ability to walk, and fine movements. Speech therapy can help with speech problems. If other treatments do not help, surgery may be an option. Surgery for Parkinson's either destroys or stimulates parts of the brain.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Parkinson's disease is a common condition. Some people have almost no symptoms and others have a lot of symptoms. The first symptom of Parkinson's disease is usually shaking or tremors. The causes of Parkinson's disease are not known, but we know that in people with Parkinson's, neurons in the substantia nigra slowly die off. This causes less dopamine to be made. With less dopamine than normal, there is less dopamine than acetylcholine in the brain. This imbalance causes the symptoms of Parkinson's disease. Parkinson's disease is usually treated with oral medications first. As the disease progresses, oral medications may not provide consistent relief. Some patients also have trouble swallowing. These patients may try a patch, injections, the placement of a tube that carries medication to the intestine, therapy, surgery. Surgery for Parkinson's either destroys or stimulates parts of the brain. The success of the treatment mostly depends on clear communication between the patient and his or her healthcare provider. Thank you for using Explain.